Welcome back to Houston Life. Have you ever felt totally confident until you started thinking about your smile? If you've been hiding your teeth or putting off fixes that don't really last, new advancements in dental implants may offer a stronger, more natural looking option than traditional veneers because it starts with a healthy foundation. Joining us now is Dr. Michel Azer, surgeon and founder of the Texas Dental Implant Center, along with his patient Teresa Dermit, who is sharing her smile journey with us today. All right, Teresa, you are beaming from left to right. Your smile is beautiful, but I know, coming from a background of many years in orthodontics and doing dental things on my own, I know what kind of struggle it is. So let's talk about how you got here today. What was your story like?
Well, I actually got here today because I was a fan of Houston Life, and I have been watching for a long time, and I saw Dr. Azer on here, and I had so many issues, especially since COVID. I'd always tried my best to stay on top of taking care of my teeth and doing what I had to do, but it just progressively got away from me. And so seeing him gave me the confidence to start to research to see what I could possibly do to improve everything that I had going on.
Absolutely. And you know, sometimes it is the way you don't floss or brush, but sometimes it is genetics, right?
Yeah.
The periodontal side of it. What were you experiencing, Teresa, that kind of put you over the edge?
What put me over the edge was I did have back teeth that were missing. I lost fillings that I'd had as a child. And through a very small accident, one of my front teeth became loose. And that was the end for me.
Because
I did not want to lose a front tooth.
We're talking about confidence right
Of
there.
course.
Absolutely. And you said this was not a decision that you made lightly. You had been thinking about this for how long?
For years. I actually laid awake many nights for years, just wondering what I could do. But too, I had to wait for the technology to be there to do what I did.
Absolutely. And Dr. Azer, we know the technology is there today, right?
Yeah, I think we came a very long way. This used to be a very huge procedure, multiple steps, months or if not years of rehabilitation to finish it. Maybe Teresa just mentioned it before we start the show. It's after the surgery day, it's fun. It's almost painless. We're really defining the shape of the teeth and talking about all the details. I remember one of the conversations we had, she told me, I asked her, like, what do you want to change about your teeth? She told me, I don't know, you just do it.
Just do, you're the professional, right? We're seeing
Right.
a digital version of your lab actually right here, Teresa. But Dr. Azer, this is something that you're not trying to change. The goal is not trying to change her face. The goal is trying to give her a beautiful smile that fits her, correct?
Yeah, I think that's the biggest thing with her specifically. I mean, she's a beautiful person, right? She takes care of herself. And I don't want to change that. I just want her to, when she smiles, she just shows her full potential for expressions. We're not changing that, and that's the goal.
It's just enhancing it, just enhancing what you already have, right?
Absolutely.
I want to talk about this procedure because a lot of people have the idea that veneers are the only way to go, right? Let's talk about what Teresa had done and how she went about having it done.
So when Teresa came in, the genetic component, which we just mentioned, she's probably taking care of her teeth as maybe more than an average person would, but still her bone is not responding to that. She mentioned to me that she had periodontal surgery, she had implants before, and still the dental disease or periodontal disease is still progressing. And at that point, we had to draw the line, because if we jump that step of periodontal treatment and then start doing veneers, the teeth are going to look good for maybe a few years, and then things are going to start shifting again, and it's not a stable foundation. So we had to go the other way and tell her that's not an easy decision, but we'll have to take the teeth out and then replace them with implants. You're not going to spend a single day in dentures, because dentures are really, it's going to make you feel not like yourself.
Exactly. That will make you feel like you're having something done. I want to talk specifically about the ONEARCH procedure because I am intrigued at how far this technology has come.
Yeah, so it's the advances in surgery that allows us to take the teeth out at the same time, place the implants, and everything is digitally designed. The implant positions, the design of teeth, so that on the same day we're able to get our patients same day teeth that we call the temporary teeth or healing teeth until everything looks good in a few months, and then after that the final teeth are ready.
Teeth are ready to go. Oh man, Teresa, for anybody that's putting this off, what kind of advice do you have for them?
Don't put it off. The hardest thing for me was just to make the initial phone call to go in and talk to Steve, because I didn't know what his recommendation would be.
Look at these before and afters. It's almost something that you don't know that you needed until you see the final product, right? How do you feel about looking at that?
I feel great now, yes.
What was the first meal that you had?
It was still soft food for a little while.
And then the popcorn in the can. I'm just kidding. Yeah. She didn't do that.
Yeah, we always joke that it was Jordan almonds. Don't eat Jordan almonds until you get the permit.
Absolutely, absolutely.
Yeah. So, yeah.
Well, you look wonderful.
Well,
Dr. Azer, incredible job. I am so thrilled for you both. I know that you stopped and took a photo of her the second she put those teeth in.
I cannot say enough wonderful things about him and his passion for what he does. And I've told him before, there's no one else that I would have taken this part of my journey.
There sure is. There's no one else like you, Dr. Azer. Thank you so much. Teresa Dermit, Dr. Michel Azer, thank you so much again. The Texas Dental Implant Center has a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. The consultation includes a one-on-one chat with Dr. Azer, a 3D scan and x-rays, a $1,000 value. To schedule your appointment, call 346-ONEARCH. That is 346-663-2724, or learn more online, bestdentalimplantshouston.com, and scan the QR code below to see more patient transformations. We'll be right back with more Houston Life.